Oh. What? Roving butt implants, crushing chest capabilities, and wearing your heart on your chest. Today, we're back at it, breaking down and reacting to some of the most extreme plastic surgery fails and body modifications you've ever seen. Let's dive right in.
My name is Jabrina, and my butt is making me flip out.
Right now, we're gonna just
Whoa!
see what I deal with on a daily. So if I sit wrong, if I do anything wrong,
it moves.
Flips over.
Whoa, so they're just like sitting in there, having their own dance party, flipping and spinning around. So not appropriately anchored, not probably the appropriate size.
I don't have to have a Nicki Minaj booty. I'm skinny, I don't need Nicki, but I want a little something. And if you wanted a butt, you gotta either get the fat transfer or the implants. I didn't have the fat. I wanted the butt, I got the implants.
Okay, at least she knew her options and she wanted to have a larger buttocks. Having your butt enhanced or enlarged would be a Brazilian butt lift or a BBL. And that basically is when you take your own body's fat from, say, your abdomen, and then you do a liposuction to those areas, and you take that fat, you purify it, and then re-inject it into the areas that you want to enhance.
Jabrina has what we call implant malposition. Not only are the implants in a pocket that's way too big, but they're in the wrong plane in the pocket, allowing them to flip around too easily.
So the wrong plane these implants were put in, thus making it a lot easier for them to move around, and then the pocket being too big, causing them to be able to flip around and literally do somersaults in there.
Brought some surprises with me.
You have something here?
Yes.
No.
Okay. Come on.
Get over it.
Let's see.
Okay, what do you got?
Okay, is this your surgery hand?
Oh my gosh.
This is, yes.
That is a surgery hand.
Yes, okay. He's a brave man.
Wait a minute, what?
What? Say you don't have an implant. Doing that is going to cause significant bruising, pain, a large hematoma, significant amount of swelling to the area, and you're not going to want to do it because it hurts so bad. Causing injury to your own breast, there could be a large hematoma or blood clot that forms underneath the tissue. That could either get reabsorbed by the body, which it often does, or it could actually start coming through the skin and actually the body expel it and then having a pretty decent scar there. Oh my gosh.
Are you ready?
You're not going to do a watermelon here and get that over the place.
Yes.
No, I'm not going to
Do it.
Wow.
Susan has a lot of force.
She's able to break an empty can. Okay, takes some force, but not a lot. But a watermelon takes almost 300 pounds of force to be able to smash it like a sledgehammer. My first reaction is that this should still cause pain to the skin, to the nerves that innervate the area, to the underlying structures, but didn't seem to bother her, which the doc is also concerned because it's like, wait a minute, if this doesn't bother the breast tissue, there's something wrong. The implant that's in there could be encapsulated, could be solid, it might have so much inflammation around it that it's actually walled itself off. A couple different things that can go on.
My name is Albert. I am 29 years old and I am from Modesto, California. And I am literally missing my left pec.
Oh.
As a bodybuilder, it sucks actually. My right side was growing muscle and then my left side wasn't catching up at all.
Poland syndrome is a rare genetic disorder, and it has to do with basically the underdevelopment or lack of development of the pec muscle, your chest, usually unilaterally, and it can involve not just the muscle, but also the ribs on that side and even hand. It's mostly related to the pectoralis major.
At that time, my aunt had mentioned that there was a doctor in Mexico. He had done work on another relative, breast implants, and she said he was a really great doctor, and then I was really anxious just to get it done. And it was gonna be like maybe half the cost.
He's going out of country to Mexico, where a lot of people do have surgeries out of country because they're typically financially more affordable, but you run the risk of potentially poor care.
There was this random nurse lady. She didn't speak English, so she was just holding a bucket in front of me. I'm just throwing up everywhere. As soon as we got back, we rushed to the hospital and went and saw a doctor, and he obviously had no idea what was in there, so he said that my body was rejecting it.
In this circumstance, whatever implant might have been used, his body might have rejected, and so it's hard to know exactly what he had, but you also could have a reaction to the anesthesia. Unlikely you're gonna have an infection sit in that fast. So when somebody has nausea, vomiting, and not feeling well, either your body's reacting to something foreign, or it could be reacting to medications that you've had.
My name's Ayla. I don't consider what I do to my body mutilation. I just think it's Accessorizing
implants.
body modification is just kind of adding something that's different to your body.
We've seen this before on this channel where people do put subdermal implants in. Some people might have a reaction while others may not.
What's this? Oh, it is a silicone implant. I had the heart subdermal implant put into my chest because I wanted something different as opposed to just a big tattoo, because it is such a pretty part of a girl's body and I didn't really want to deface it but adorn it.
Let's talk about people who might reject these. What would you see? You typically end up seeing these being pushed out. The body would reject them like a splinter. You get a splinter, you can't get it out, and then over time it actually starts to make its way out. Same idea here. Sometimes these will erode through the skin and make its way out. I've seen this multiple times with different types of piercings.
The scar is from the original incision. The first implant that I got was about a 1/4 inch thick. It wasn't very visible. I figured if I'm gonna have something there, I might as well go all the way, and that's when I got the second one put in.
You know, it's in an area tiny bit concerning. It's over the sternum, so you just don't want to get an infection over the sternum into the sternum itself. That's something called osteomyelitis, because then your underlying structures are so important there. You get sternal infection, your heart's sitting right there. You get your heart infected, leading to myocarditis, endocarditis, and you might be, you know, in a world of hurt.
First impression of Trevor is that, hey, here's a good-looking guy coming in with these huge things on his ears.
Decided to get my ears pierced. Maybe 3-4 months passed and I started developing a keloid.
Wow.
Cut it off.
So what's a keloid? Keloid is excess scar tissue, and just depending on your body, some people will produce more and more scar tissue versus others. People sometimes will get branding when they go to fraternity. Instead of getting a tattoo, they get a brand, and you can see that they get these big scars and they're keloids.
So the good news is on your right ear. You can actually remove some of that keloid, or most of it, about 90% of it, maybe 95%. The problem with the left ear, the keloid has replaced the earlobe. We have to try to reconstruct that. So they're not going to be perfectly symmetric.
So that's good, having the conversation with the patient about the appropriate expectation. We do this a lot in the emergency department because our job in the ER, when people come in, it's emergency, right? Life-saving things, treating things appropriately. We get a lot of people that come in wanting to know what their chronic medical condition is. And sometimes we can help figure it out, but a lot of times we don't have all the resources, the time, the long history to figure this out. If you want to see more of this, definitely let me know in the comments. We'll do more and more episodes of plastic surgery fails. It's medicine, it's patients, and you're able to see kind of some of the ailments that they have and what they go through and what their concerns are. Also, check out my new supplement company called Life Happens. And as always, make sure that you check out this playlist right here. Binge watch everything for me, and definitely subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.